I have an outline, which I'll just go over briefly, and then you know what's going to come ahead. So our topic is gender, emotion, and nonverbal communication. How did I get into this topic, and why do I think it is important? That's the first thing I'll say. I'll say a few things about how big are gender differences in this field on this topic. Do they matter? I'll talk about gender stereotypes. I'll talk about gender and the emotions that people feel, and also the emotions that they show. And I'll also say some things about gender and nonverbal communication more generally, because as I'll explain later, nonverbal communication is not always about emotion by any means, although it's importantly about emotion. And then I'm going to talk about one of my closely related research topics, which is medical practice. So you might say, what does this have to do with this topic? And my own background as a social psychologist who studies communication. The answer is that medical care, as you all know, of course, is a social transaction between a healthcare provider and the patient. And most of what doctors do is talk with patients. I mean, they apply their cognitive skills and their knowledge and their wise judgment, or unwise, but they do a lot of communicating, or they should. So there is a very close attachment between that topic and the other things I'll be telling you today. So I hope you'll enjoy that way I'm going to end up my talk. So I have to always make some disclaimers and some explanations about terminology. So gender and sex in the profession of researchers who study this are sometimes distinguished as having subtly different meanings, but I'm going to use those terms kind of interchangeably. And I often do even in my own writings. I'm not doing that just because I'm giving a talk today. This ignores the complexities of the gender concept. We all know that our ideas, our standard traditional ideas of gender as consisting of two groups, the men and the women, is changing rapidly in society. And I know this personally because one of my own children is in one of the atypical categories, who doesn't want to be a man or a woman. And we all know that there's a continuum and there are many variations of gender identity and sexual orientation. I'm not talking about any of that today. I wish I could, but there isn't much research on it, so I'm just not going to talk about it. So when I say gender or sex, I'm talking about the very conventional understanding that we have of two groups, the men and the women. And I know that's a simplification, but it's not just a simplification that I'm making, it's a simplification that exists in the research, because researchers themselves are just becoming aware of the need to expand their definitions of these concepts and actually study atypical groups. So I wanted to say that. Are you still hearing me okay? Alrighty, good. So how did I get into this topic? When I was in graduate school at Harvard, I helped my professor on a project which was to make a new test, an actual test that somebody can take, that measures how accurate you are at understanding nonverbal cues that somebody is expressing through their face, their body movements, and their voice qualities. So I helped with this test, and we did many, many studies to validate this test. And one of the things we found over and over with our test was that girls and women scored higher on this test than the men did. Not dramatically, but consistently. And then I started reading other studies and discovered that we weren't the first people to find this, that there actually was a research tradition that went back 50 years of researchers who had been looking at this very same thing And they almost all found the same thing. So I proceeded to do my own dissertation for my PhD on the topic of gender and accuracy in perceiving cues, nonverbal cues or expressions from other people. And that got me started on this topic. So gender, nonverbal communication have been my topics for almost my whole career. And why do I think it is important? It's because society is still very organized around the gender concept. We can't escape that no matter how alternative we get. Our occupations are not distributed equally. Our roles at home are not. There are stereotypes about the genders. And men and women don't act exactly the same. I don't think that's an arguable point. And there are also disparities out there, which everybody's aware of, and President Obama has been talking about pay inequity lately. There's gender discrimination in the sciences in hiring to this day. There are discriminations and disparities in healthcare according to gender. There are many. I'm not going to overstate anything, but it's probably unarguable that we're not all on a level playing field anymore. I mean, yet. And there are real impacts of stereotypes and behavior differences between men and women. So it's not a topic that has lost its relevance in the 21st century. It's one that's well deserving still of research. So what's nonverbal communication? Let me just make sure we're all on the same page here. So as Joe said, we communicate nonverbally, and sometimes researchers in this field say you can't not communicate nonverbally. You can not communicate verbally. In other words, you can not talk. But as long as your behavior is witnessed by anybody, there's a communication process going on, whether you intend it or not, and whether that person perceiving you is correct or not. They might be misinterpreting you. And there are many communication dysfunctions between people. So most of the time people communicate pretty well, but it's not always completely accurate. So the point is, you're always looking a certain way and acting a certain way that people will take messages from. And sometimes, as I said, you intended it, and sometimes you didn't intend it. So the nonverbal cues that we study mainly are facial expressions, gazing patterns, where you look when you're interacting with people, how you move your body or sit in different postures, how you use your hands and arms and legs, how close you stand to other people, and how much you touch other people, and what kind of vocal qualities you have, loud or soft, or tense or relaxed, or expressive or not. So there's many different sub-variables within any of these nonverbal cues. I've just given a very general list. So in this field, and I'm going to touch on both of these following two things, we study how people behave, but we also study how people perceive other people's behavior. And that second thing, how we perceive other people's behavior, has been my own special interest ever since graduate school. So the question being, how accurate are we at interpreting other people's cues? And how can we measure this? Because you can imagine it might be a challenge to measure if I'm accurate about you or you're accurate about me. So that's interesting. I'll be talking about both behavior and accuracy. So now let me say a word about how big are gender differences in this field. Let me go on the record to say I am not talking ever about total differences, like all men do this, all women do that. That would be absurd. There's an enormous amount of overlap in how men and women behave. So there's a lot of men who act more on the female, quote unquote, dimension of behavior, and there's a lot of women who act more. So these are not separate distributions of behavior, they're overlapping distributions, but they're not fully overlapping. And research over and over and over, shows differences. And those differences are notably big in the nonverbal communication field. And in fact, they're as big or bigger than many other psychological gender differences, which have also been studied extensively by many researchers. So these are not trivial effects that I'm talking about, but I do want you to know that I'm not exaggerating them. Okay. I also want to say that most of what I'm going to say in my talk, and have said, is very closely connected to research data. I don't like to speculate very much, so I'm not just making wild statements or statements of opinion. I mean, sometimes I am, but I'll try to tell you when I am. I really stick very closely to research. I don't have any citations to give you. Well, you can't see my slides anyway. But just rest assured, I'm telling you about research that is based on data. Okay, gender stereotypes. That's the first topic I'm going to take up. Cross-culturally, these kinds of questions have been studied not just in the US, but in other places in the world. So cross-culturally, women are believed to be more emotional than men, to have more frequent emotions, and to have more intense emotions. Similarly, women are believed to be more emotionally expressive and also more emotionally skilled. Now, much of what I'm going to tell you will not come as any surprise to you because everybody is probably fairly familiar with cultural stereotypes about the genders. We've all grown up with them, right? You also may not be too surprised to hear as I progress that the stereotypes are pretty correct. And maybe that's because the stereotypes are based partly on the actual behavior of men and women that people have observed. But there's a chicken and egg because sometimes the behavior is the product of the stereotypes, of course. So we can't unravel that very effectively. So, continuing with stereotypes, there are stereotypes about specific emotions, not just overall emotionality or overall expressiveness. So women are believed to experience more happiness, embarrassment, surprise, sadness, fear, shame, and guilt. So except for happiness and surprise, most of these are negative, vulnerable emotions, which is an interesting thought. We can pursue that later. Men are believed to experience more anger, contempt, and pride. I don't want to comment too much, but that is the stereotype. All you gentlemen, please don't take offense at anything I say. It's just science. Okay. Now I want to introduce to you the concept of display rules, which is not a term I made up. It's a regular term in our field. So display rules are the norms or prescriptions that exist within a culture for how people ought to show their expressions. And we're all familiar with the display rules, although you might not have heard that word anymore previously. So we know that if you're in a funeral, generally you don't laugh and giggle and stuff. But in some cultures, they do, because that is their cultural norm about how you behave at a funeral. So every culture has its own rules about expression, and most of us follow them most of the time. And when people don't follow them, we really notice it. We don't notice it so much when everybody is playing by the cultural rules, but we do notice it when they break the rules. So these display rules also exist for men and women and how they ought to be behaving. So cross-culturally, it has been shown that it's considered prescriptive or appropriate for women to show happiness and sadness, and inappropriate for men to show fear, while it is okay for men to show anger and disgust. So this aligns fairly well with what the stereotypes are, which is no surprise. So cultures, society are bearing down on all of us to live up to these expectations and sort of behave in the way that's expected of us. And I'm sure all of you have had experiences in your own life which might have upset you or gratified you, I don't know which, but where you were very conscious of how society and other people around you are expecting you to behave in a gender congruent way. So, and that is still true in society. It's not like we've outgrown that. So, now I'll talk about gender and the emotions that people say they actually experience themselves. So previously I had been talking about stereotypes and expectations. So one thing that's known is that the gender differences in what people say they feel are weaker. They're there, but they're weaker than the differences in how they behave, in their expressed emotions. And this is true in both stereotypes and in actuality. So let me just repeat that again. So men and women do differ in what emotions people believe they have and what emotions they say they have, but the bigger differences are in behavior, what they show. So in other words, men and women often feel the same or not too different, but women will display it more. Whether they're doing this on purpose or spontaneously, sometimes it's hard to know. Probably both happen. And in line with what I was saying a moment ago, there's this catch-22 about expectations, because if you don't behave the way you're supposed to behave in terms of your expressiveness or how you express your feelings, you can be punished for it sometimes, or rewarded if you do behave. But in other contexts, the punishment is if you do behave according to the gender expectations. So sometimes it's kind of like damned if you do and damned if you don't. If you're consistent with the gender expectations, that's a problem. But if you're not consistent, that's a problem. Okay, so one more thing on felt emotions is that women report more of what we call emotional contagion, which is a very interesting thought because it has a sort of an infectious disease metaphor to it. But emotional contagion is catching somebody else's emotion. So if they're sad, you're sad. If they're happy, you're happy. And women experience that more than men do, which is probably one reason women are stereotyped and sometimes are more empathic than men, because this is in fact one of the definitions of empathy, is that you feel what other people are feeling. Specific emotions that differ by gender. So now I'm on what people actually say they feel. Women report more positive emotions than men. They report more joy, more love, more affection, more warmth, more empathy, and more sympathy. So those are nice things to feel. I don't know what the implications are of men saying they don't feel those things quite as much. Sometimes the self-reports are colored by the societal stereotypes, so that people report feeling what they think they ought to be, you know, according to the expectations. So there again, you sometimes wonder what the data mean, but that is what the data show. So women report more of these positive feelings than men. They also report more negative feelings, which fits with the stereotypes I told you about before. Women report feeling more vulnerability, more fear, more anxiety, more hurt, more shame, more guilt, more embarrassment, more sadness, and more depression than men report about themselves. And you probably know women are more vulnerable to depression. That's well-known epidemiological result from the public health literature. All the reasons for that, nobody quite knows. One thing that's quite interesting about these felt emotions involves anger, because the stereotype says men are allowed to have anger and they have more anger, and that's a very masculine, sort of a dominant thing. But the reality of what people report feeling does not support that very well. It's often women who are angry, and that's fascinating. That may be one that they suppress showing, maybe some, but women, if you ask them, they will often say, yeah, I'm plenty angry. And I have lots of those feelings. So anger is not such a clear picture. Now, you may have heard of a concept, because there have been lots of books written about it, called emotional intelligence. Have people heard that term? Yeah, some of the books that you'd find in the bookstore are kind of popularized books, but this is a very respectable research topic in psychology, and they're very good researchers pursuing this concept of emotional intelligence. And so what is it? It has to do with whether you are savvy about emotions and are able to use emotions for your own benefit or for the quality of your life in good ways. So let me tell you what some of the components of emotional intelligence are. Understanding the emotion landscape, like what are all those emotions that exist and how do they differ from each other? How do I know when I'm feeling one of those emotions? Sometimes we have feelings that we can't name, right? I mean, that happens to all of us. Or we have ambivalent emotions. Sometimes, so that's one aspect of emotional intelligence, is if we feel confident that we know what we're feeling. So sometimes that's called naming your emotions or recognizing your own emotions. And emotional intelligence also involves a willingness and an ability to think and talk about emotions. So that's one of the components that researchers include when they measure this concept. And the final thing, there's two final things. Another one is whether people are accurate at perceiving other people's emotions. So I already mentioned that before. And finally, there's what we call emotion regulation. Like, can you change your emotions when you need to? So we've all had the experience of being in a bad mood. Do we know how to fix our bad mood? Do we know some strategies that we can bring to bear through distraction or reframing how we think about something or changing the situation we're in? There's many things you can do to regulate your emotions. Some people are good at that and some people are not so good at that. And so they might get caught in a cycle of negative feelings where somebody else might be able to break themselves out of it. So that's called emotion repair. Very interesting concept. So all of these things fit under this umbrella of emotional intelligence. Whoops. I don't know where I have what I want to say next. But what I want to say next about emotional intelligence is that the research is showing increasingly that women have more of what the researchers call emotional intelligence than men do. Let me footnote that with another comment. In our society, women are expected to be emotion experts. That's one of the roles that women are brought up feeling and knowing it's kind of their job to understand emotions. And to use that knowledge for quality social life, like making sure a social situation goes well and that people in the group are comfortable. It's sort of like women have a tendency to keep their finger to the pulse of a social situation. One of my favorite scenes in literature is from a novel by Virginia Woolf that's about a dinner party where the hostess is communicating just by looking at her woman friend who's at the other end of the table. They can't speak to each other because there's a lot of people sitting between them, but they're communicating mentally about how it's going, who's talking to whom, and who needs to be kind of rescued by somebody else and brought into the conversation, and so on. It's a masterful scene, and it so captures the idea that women are expected in our society to be kind of in charge of people's social well-being, for better or for worse. Sometimes we don't want that role, but that is the role that society ascribes to women more than to men. So some of this intelligence, social and emotional intelligence skill is acquired, obviously, through a lifetime of being expected to know what to do and how to fix social situations and make them go well. So I'm never claiming anybody's born with any of these qualities that I'm talking about. This is very much a socially developed set of phenomena. Okay, now I'm going to move on to the behaviors. I've talked about stereotypes, and I've talked about feelings, and now I'm going to talk about how people actually behave. So women are they really are more expressive than men through the face, through the body, and through their voice. And as I mentioned earlier, this sounds familiar to you because you've all noticed many of these things in your own lives. So it's probably not startling, but this is the confirmation from research. So women are more expressive. Women are more skilled than men at expressing emotions when they want to. And this is done through laboratory methods. But they're also more spontaneously expressive of their emotions. So even if women don't know anybody's watching them, they'll be leaking out or spontaneously displaying how they feel more than men will. Because don't we know that men are more likely to be brought up to repress expressions? Huge variation again, but there's a wonderful study showing that on preschool children, showing that between the ages of 3 and 5, the boys become progressively less emotionally expressive until they're less expressive than their girl counterparts. But they didn't start out that way. So it's strong evidence of a learning phenomenon here. Parents talk about I don't know, I think I'm out of order. I said something on a slide that doesn't make sense, but I'll say it anyway. It's just not in the right spot. That parents, as part of this socialization process, are talking to their children, about emotions in different ways. So there have been good observational studies showing that the emotions that parents talk about with their little girls are the fear, the sadness, the happiness, and with boys, they talk about boy emotions or lack of certain emotions. And this is also true in children's literature. The storybooks and fairy tales and everything reinforce these same stereotypes. So what you've gathered is that the stereotypes kind of match the actual behavior patterns, and that's correct. That is true. The stereotypes are remarkably correct. Also, if we move kind of out of the emotion realm to talk about a variety of other nonverbal behaviors, because as I said, nonverbal behavior is not always about emotion. The research shows the following, which is also consistent with stereotype. Women smile more than men. I'm sure that's a big surprise to you, right? Women smile more than men. They look more at other people when they're in a face-to-face interaction. They are more likely to actually face another person directly if they're communicating, like head-on instead of off at some kind of angle. They stand closer to other people. They touch people more, and they gesture more with their hands than men do. There's other things too, but that's enough. And then there's some things that men do more than women. They have more restless feet and legs. You might not have known that, but that comes out of research. Here's one of my favorites. Men are more likely than women to say and when they're talking. We call that filled pauses. It's actually quite a notable effect. Now that I've told you, you'll go listen for that, and you'll hear it, actually. My husband is dreadful. He does it all the time. Now, nobody knows exactly what function this is serving. One hypothesis is that it's a kind of a dominance behavior, because if you're talking with somebody and you don't want them to interrupt you, but maybe you need to pause to think about what you're going to say next, if you just pause, they might interrupt you and take a turn. But if you say, you're holding your place. You're keeping the place for yourself to prevent that person from breaking it. That's not the only interpretation of these filled pauses, but that's one. Also, men interrupt more than women do. Now, that's not always true, because I think the highest of all interruption rate on the planet is girls with each other, or even women with each other, because everybody wants to talk at the same time, and it's not a dominance behavior, it's a participation behavior. So interruptions don't always mean dominance, but if it's a man and a woman talking together, the man is more likely to interrupt than the woman. Okay, so let me go on to recognizing emotions. I've already said women have skill at this. They also recognize and interpret other kinds of nonverbal cues somewhat better than men too. For example, in judging what kind of personality a person has, in remembering what a person looks like, or remembering their behavior when asked about it later, which is another kind of social skill, right? We use that kind of memory in order to guide our own behavior and to help us understand what a person was thinking or feeling. And so women's thing about nonverbal communication, being more attuned to it and more accurate at judging it, is not just about emotions. It's about quite a few other things too. And in answer to your question about, are women always more interpersonally sensitive? The answer is no, they're not always. They're not better than men at detecting lies, which is interesting. Not sure I know why, but maybe it's because detecting lies is not a very gender stereotypic thing anyway, whereas figuring out who a person is, personality, or what they're feeling, that's more of a gender stereotypic female thing. So women learn it. Okay, so what are some real life implications of all the stuff I've talked about so far? Well, we have personal relationships, because many of you are probably married or in some kind of a long-term relationship with a partner. And one of the commonest issues in the clinical and counseling psychology field is what they call the approach-withdraw syndrome in couples. What does that mean? It means that one person is approaching, metaphorically, like approaching, talking. I don't mean like physically approaching. So they want to deal with something. They want to express it. They want to talk about it and dissect it. And the other person stonewalls and says, no, 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 I don't want to do that. Let me get out of this situation. And the approach-withdraw syndrome in couples is usually the woman wants to approach, the man wants to withdraw. This is the commonest thing in couples therapy because women want men to be more expressive and more able to talk about feelings. And the man often says, So, now what about workplaces? There's research showing from a wonderful researcher at NYU showing that in work organizations, very valuable behaviors which are characterized as citizenship behaviors in an organization, which every organization needs to run smoothly and to be happy and functional and efficient, that kind of citizenship work, when it's done by women, doesn't get the credit that it gets if men do it. And that's a theme that I'm going to pursue when I turn now to talking about doctors, because it's a consistent theme. You'll see why. So why would the citizenship behaviors be given more credit if men do it than women? The reason is that people expect women to be helpful and to take on those tasks of organizing the departmental party or leading some other pro-social or helpful or organizationally useful activity, which is sort of not officially what the organization is there to do, but is really important, right? We all recognize what I'm talking about. It's just kind of assumed that women do that, so it's hard for people to detect its value when women do it. But when men do it, it's not so expected, and then it seems fabulous. Okay. So now I'm going to turn to doctors and say a few more things. We started late, so give me another 10 minutes. Is that okay? Okay. So gender differences among doctors, which I've been studying for many years now, are quite evident, and they have an impact, along with the stereotypes. So the first thing I want to explain is what the new model, not brand new anymore, but the current model of medical care is called patient-centered medicine, or sometimes it's called relationship-centered medicine. It means that the doctor, or other healthcare provider, but I'll say doctor, the doctor perceives the patient as a whole person, not just their symptom, their broken bone, their headache. They take a wide perspective rather than a narrow perspective on the patient. And this means that it is now relevant for doctors to consider people's emotions. Emotions has a lot to do with health, right? Causing health or being consequences of bad health. Stress, psychosocial and lifestyle issues, background expectations, culture. These are all things that now doctors are supposed to pay attention to. And they're supposed to build a relationship that's person to person. Doctors are also supposed to share decision-making and work to help the patient to participate in their care and in their treatment decisions. Not all doctors do, we know that, but that's what they're being educated to do now. It's considered the way to be a doctor. And the reason is that there's lots of research showing that this really helps patients to be healthier, to want to come back to the doctor, to want to do what that doctor says, and to, et cetera, and to take control of their own health. So, in a nutshell, the patient-centered model is caring about the patient and not just caring for the patient. Okay. So now why did I raise that? It's because, as you'll see shortly, the whole repertoire that you've heard about women's behavior matches the patient-centered model, because the way they want doctors to be now is the way women already are. I once said, I was speaking to a gathering of physicians who were mostly men, and I said, I regret it now, but it makes a good story. I said, if you take all of the skills into account, women are better doctors. Wait a minute, it gets worse. I said, and they were better doctors before they went to medical school even. That's the part that really got them. So But now you'll see what I mean. Okay, so here's how women doctors behave, more so than men doctors. Let me repeat again. There's huge variability and huge overlap. These are not categorical differences. But this is all based on research. Women ask about somebody's psychosocial experience, that meaning that, like stress, what's happening at home. What about the fact that you have an empty nest now? How does that make you feel, that kind of thing. And also life arrangements, like how does your, being unemployed affect you, that kind of thing. Women engage in more partnership building. They try to build more of a democratic, less hierarchical relationship with the patient. And they engage in more talk about emotions and lifestyle and psychosocial issue. They express empathy more. Women doctors engage in more positive nonverbal behavior. They smile more. They nod more. And they do a thing we call listener responses, which are, if I'm talking to you and you're talking and I'm listening, I say, yeah, Those are listener responses. Women do that more than men do anyway. I didn't tell you that before, but women do that more. And also women doctors do it more. The sum total of smiling, nodding, and using these listener responses is that patients keep talking because those are encouragers in interaction. So patients talk more to women doctors than they do to men doctors. And in fact, when it's a woman doctor and a woman patient, they talk the same amount, which is almost unheard of otherwise. Also, women doctors engage in more positive talk, more agreement, more respect, more praise. Okay. And patients of female doctors feel more liked, and in fact, they are more liked, because that's been shown in research, is that women doctors like their patients more than men doctors do. Patients, as I already said, patients talk more to female doctors. They give more information to female doctors. And they're actually more assertive with female doctors, which is a good thing, because that's what we want patients to be now. There are some troubles going on in this field, which is interesting. Signs of trouble that partly stem from stereotypes. So let me say that, like in the organizational studies, women doctors don't get the credit they deserve for this patient-centered style they have. So I'll speed up a little bit so that I won't go through too much detail since I'm running out of time. I apologize. One interesting finding from the literature is that you might think that if women doctors do all these things better than men doctors, the patients must be more satisfied with them. Well, the answer is no, they're not. It's about equal. And you might say, well, equal is fine, but equal is not fine if one group is actually performing better than the other group. And satisfaction really matters, not just for the patient, but for the doctor, because in a lot of organizations, their pay is often geared to their patient's satisfaction ratings. So women are being better on the communication side of being a doctor, but not being acknowledged for it like they should. So in my laboratory or with colleagues, we've conducted a number of studies, some of them in the laboratory and one of them in a big major hospital where it was real doctors and real patients. And what you consistently find, even in naturalistic settings and in the controlled laboratory settings, is that if a male and female doctor act identically high patient-centered, the patients love the men and say they're wonderful doctors, but it has very little impact on their evaluations of women. It's a fascinating result, and it keeps turning up. What is the reason for this? Well, the reason, here I am speculating, but I think I am correct. The reason is that all of these patient-centered things just seem like normal female behavior. That's how women act. So they're being very good women, and we like them. But we don't translate that into what a good, skilled doctor that is. So when the researcher comes around and asks for the satisfaction with the doctor and rating them on the different qualities, it doesn't get represented there. This is a real source of disparity for women doctors. It's a shame. So that's what my current research is focusing on more than anything else.